is Emma, and I was in a group with Margaret and Johanna, and we did melanoma skin cancer. So what is it? It's a skin cancer that begins in the melanocytes, which are the cells in your skin that produce pigmentation. And it usually appears on a mole or nevus, which is also known as a birthmark. Researchers think that ultraviolet radiation damages the DNA of melanocytes, which can cause them to grow and divide uncontrollably. And melanoma accounts for 4% of all skin cancer cases in the United States and 80% of cancer deaths. And because melanoma focuses on the moles and birthmarks, it's because there's concentrated areas of melanocytes there, so they're easier and more susceptible to becoming damaged. And also skin cancer is the most common cancer in the United States. So symptoms and assessments. Basically for symptoms, if they have any change in an existing lesion, which is a mole, birthmark, any other skin abnormality, and then development of a new lesion. So the photo underneath there, as you can see, kind of tells you, like it compares side by side a normal mole and then different ways that melanoma presents. And the way to remember that is A, B, C, and D. So asymmetry, border, color, and then diameter. And for assessments, it's very important for the patient to note any changes in their birthmark or mole, or if a new skin lesion occurs. And then a physical exam to inspect and palpate the scalp and all surfaces of the skin, and accessible mucosa, which is nose, mouth, etc. And then you also want to do a psychosocial exam, just because you never know how they might respond to a cancer diagnosis. So causes, there's a fair amount of causes. So fair skin, blonde or red hair, tendency to develop more freckles, just having fair skin in general. Presence of nevi, which is again birthmarks or skin lesions. Positive family history, sunburns early in life, tanning beds are a big one, and then immune suppression. Okay, so then for a diagnosis, you will have a physical exam, and that just includes a head-to-toe exam of your skin to look for abnormal shape or pigmented moles or birthmarks, anything like that. And then they'll also potentially do a biopsy if they see any places that look potentially cancerous. And there's different types of biopsies. So the photo on the bottom left or right for you guys with the little shaver, that is a shave biopsy. And that scrapes off the top layer of the skin, and it might not be thick enough to determine the degree of cancer invasion, but it can tell you if there's cancer there. Then another one is a punch biopsy, which is in the top left with the little blue puncher, and basically they remove a deep sample of the skin melanoma cells after numbing the site, and that cuts through the layers of the skin. So that will be a more accurate test to run. You can also do an incisional and excisional biopsy, which is the top right photo, and the incisional is the top line, and then the excisional is the bottom line, and that will go a little bit deeper. And this is the preferred method of diagnosis, and it uses a surgical knife to cut through the full thickness of the skin and removes a wedge of skin. And then the fine needle aspiration biopsy or a lymph node biopsy is the one in the bottom left with the green. And then they just use a needle to remove a very small tissue fragment just to see if the cancer has spread to your lymph nodes or not. So then treatment. So there's several different types of treatment. There's surgery, which can be used in all stages 0 through 4 of melanoma. And it includes removal of cancer-affected areas. If the cancer has spread to other areas of the body, it can involve removal of lymph nodes, large portions of infected skin or tissues, metastases, and then excision of tumors. There's targeted therapy drugs for stage 2 through 4, and that's the use of drugs to target specific genes of cancer cells and block their growth. Then there's radiation therapy, which is for the later stages 3 and 4. And this therapy uses high energy X-rays, beams, and other particles to destroy cancer cells. Immunotherapy is used for stage 4, often used as a last resort. Basically what it does is it triggers your immune system to try to fight the cancer on its own. And this one isn't entirely as effective as some of the others, but they'll use it if you're not responding to other treatments. And then chemotherapy, which is stage 4, and that's just a powerful chemical drug treatment that is used to kill fast-spreading cancer cells in the body. So then, prognosis and follow-up. Melanoma has a 5-year survival rate and 91% survival rate if caught, it has a 5-year survival rate of 91%, my bad, and if caught early, a 99% survival rate. Later stages of cancer have a lower survival rate depending on how advanced it is, so that's anywhere from 25 to 65%. Care for melanoma does not end when treatment is finished, which is really important for the patient to know. Patients with melanoma have to be taught to protect cancer sites from trauma, so covering up, making sure they're protected from the skin or from the sun, and then performing self-examinations and identification of suspicious lesions. So just examining their skin to make sure their moles don't change, that they don't have any new skin lesions is really important. And then if they do see that, reporting it to their dermatologist or doctor right away. And then, of course, limiting UV exposure, so wearing sunscreen, wearing UV protective clothing, stuff like that. And then regular physical and dermatologic exams are also really good. And then these are our sources.